So glad to have you. Ken is the Chief Science Officer at IBEC and working on a Commit to Care project. And I will turn it over to you to start your presentation. Thank you.
Thank you, Katie. All right, can everybody see the presentation?
Yes, we can. Thank you.
All right, outstanding. So I'm informed this is 27 slides, so I'm going to go through fast, but I'm just going to
Sure.
brief over slides. So we are a nonprofit organization in the United States. We stood up almost 2 years ago now. It'll be 2 years in March. IBEC stands for the Integrated Bioscience in the Built Environment Consortium. We are about people, pathogens, and buildings. So what we were trying to do was weave together disparate technical disciplines and knowledge spheres to provide real world solutions for transmission reduction. So we're not just about COVID-19, we are about all pathogens. And we're taking what we feel is a more holistic and unique approach in including environmental microbiology, building and environmental systems, but also human and social systems as well, because we need to affect the people who occupy these buildings and change the way they see the pandemic or other pathogens in the built space. Leadership is needed to thrive in the new normal, and this is a new normal. We keep hearing. I had a conversation with some folks at Ocean State, and they said speak to fatigue, and I said it's unfortunate we're seeing this, but some of the things that we're going to have to begin to realize as a community, as a nation, as a world, is that there is a new normal here. There was an interesting article that was shared by the Canadian Aerosol Transmission Coalition about Australia willing to let COVID-19 burn through the continent or through the country in the hopes of it becoming more endemic. But the article is saying there's no way it can become an endemic. It's going to be epidemic. We're going to see hotspots. So we are in a new normal, and it's about community, collaboration, and consensus. So I've shared this particular graphic before, and I have talked with my comms people about having little call-out boxes or little balloons that pop up to describe what's going on here. But basically, when you're looking at the built space, we know that outdoor air helps to dilute what's in the occupied spaces. We know
Glenn,
that.
I just want to interrupt you. We're not seeing the slides change. And
Oh, advanced? Yeah, all right.
And it's not on presentation view. So.
Right. You
Yeah,
don't want
all
to
right.
so through them. You have to click on the left side and click on each one at a time, and then you can.
Let me try that.
That looks good.
That's making a difference?
So why don't you start from the beginning again, just to say that you're going forward.
Yeah.
Okay, so that was the original slide. You saw that. This is about who we are, the different areas of focus that we encompass, the new normal, and the built space. So very simply put here, outdoor air dilutes, portable air cleaners filter out. Your ventilation system also works as well to help filter out. Exhausting air through the kitchen, for example, will dilute. So these are all things that we need to consider to reduce the risk of transmission. We have established boards. We actually have a board of directors now. We have a science advisory board. We have not yet built out the applications advisory board. We're about 30 plus strong right now, and they're composed of PhDs from several universities in the US. We have some international presence as well. Dr. Lydia Marasco from Australia is one of our scientific advisory board members. The reason we stood that up is it can't just be about the IBEC team who's delivering all the content. We want to, in case we don't have answers, be able to reach out to people who have knowledge in that space, both in the federal space and in academia as well. We are a membership-based program. We're just starting out. We do have some very exciting members, some corporate members and some individual members. So I just throw up this box here is that we would invite you to join us. So one of the things that came up most recently is the pandemic preparedness plan from the Biden-Harris administration on September 3rd. And why is that so significant? Because the White House goals exist under 5 pillars. And if you look at the one highlighted yellow, ensuring situational awareness about infectious disease threats for both early warning and real-time monitoring. And if we drill down a little bit deeper, they talk about viral threat detection through environmental monitoring. Now, historically, when we talk about an infectious disease, that falls within the purview of public health, which is generally mitigated with medical countermeasures, with doctors and epidemiologists doing what they do, contact tracing, vaccinations. But now we see a need for doing more environmental monitoring and more need for environmental solutions. So one of the things they're talking about here as an example was wastewater sampling. This is becoming quite common in different cities across the globe at universities who want to monitor their incidence of COVID-19 that's occurring in their occupant populations. The other component in under building core capabilities is pathogen protection within the built environment. So this speaks to what the World Health Network is working on, what IBEC is working on, what the Canadian Aerosol Transmission Coalition is working on. We're all sending out the same messages that, yes, that vaccinations are important, human diagnostics are important, but the broader scientific community has stated emphatically that aerosol route of transmission is the primary route. So we need to exercise some complementary strategies in the built environment. And the Biden-Harris pandemic preparedness plan talks about develop and deploy new technologies to improve indoor air quality, surface materials, and related aspects of transportation, buildings, and others. So we have what we need to move forward, at least from administrative perspective. In the past, IBEC has been very, very successful in putting on online conferences. In the end of 2020, we've actually had 5 conferences that we delivered on. We had over, and we talked about issues and challenges to reopening, science and technology. The last one was actually sponsored by the Department of Homeland Security because they wanted to explore counterfeit and fraudulent PPE. We had over 1,250 attendees from 16 different countries, which resulted in 20 hours of programming, and we had over 50 expert panelists and moderators. So a little bit deeper about IBEC. We want to bridge the gap between proven scientific process and real-world application for healthy gathering. We want to create digestible information. I've heard all of you speak to this on the comms team, is that there's a lot of guidance and science out there, but when it rolls down to those who need it, they don't understand it or it keeps changing all the time. So we must make it digestible. We must translate the current science and make it easily accessible. So again, this is not news to you that you're all doing this in your current roles. We want to define practical quality control processes for healthy spaces, and we want to develop real-time measures of environmental transmission potential. Some of our activities that we're focused on right now, I've already shared the summits that we're hosting, and that's one of the links that I posted earlier was we actually have another stage of the summit that's going to be occurring on January 25th. That's next week. It'll be from 12 noon Eastern Standard Time until 5, and we're focusing on 4 key industries. First responders, education, K through 12, and institutes of higher learning, the gig economy, and lastly, vulnerable populations in the agriculture and construction industry. So this is actually supported by a CDC grant that we're delivering this under. So I encourage you all to register. There's no cost, it's free. And we have some outstanding speakers that are going to talk about these issues. We actually have the Deputy Assistant Secretary for Labor will be giving the keynote address at about 12:10. We also have a pledge program, which I'll talk about here shortly, and a membership program. As I alluded to before, we are a membership-based program. We have created some knowledge products. They include some custom knowledge products for people that have asked us to address certain things, such as masking. This was actually delivered to a hospital in New York City. We have bundled products that we put together, and we're working on e-learning tools. We haven't gone that route yet, but we're engaging on doing that. We've also created a repository for capturing articles, information related to the current pandemic. I don't know if any of you have been on or work with Figshare. We're a nonprofit. We're still standing up. We don't make a lot of money. We couldn't afford what they were offering. So we asked or contracted someone to build something similar, but more focused on us. And so what this is we give access to researchers, to members, to actually post things, to market these things. But we actually have the ability, if you can see here, you can search under keywords, you can download the content, you can actually have a discussion about what that particular piece of information is about. In addition to the Clean Summits, we've also last year at the end of the summer started with a Clean Lessons Learned series. These are short 1.5-hour sessions that focus on a specific topic. Our opening one was with Dr. Lydia Maraska, who this is the second time she's provided a keynote for us. We actually had 4 more on top of that. The latest one was addressing churches, places of worship. We've also reached out to the Associated Public Land Grant Universities to deliver a message to students at universities. So it was about healthy people and a healthy planet, fostering student engagement in emerging issues. And what we did is we let them talk about the issues and we captured those notes after they had a series of presentations by some key people addressing COVID in their community or world. So lastly, I'd like to focus on our Commit to Care program. This is a grassroots effort to provide awareness on a very high level about things in the built space that people can be educated on. It is a partnership between the American Industrial Hygiene Association and IBEC. Commit to Care is about, and CARE stands for community, awareness, responsibility, and equity. Again, this is a public awareness campaign. Our intent here is if we can create a baseline, a common understanding among employees, customers, employers, executives, that a conversation can start to occur about what needs to be put into play as far as environmental measures. We want to debunk myths about the spread of the COVID-19 virus. We want to make the complexities of the science easier to understand through various engaging multimedia tools. And we want to encourage businesses to pledge their commitment for the health and well-being of their employees, their customers, and their clients. Very simple message. Now, when I created the content for all of these, for the first one on risk factors, I wrote a 9-page document that started with an equation on what causes infectious disease. My communication staff laughed at me. They called me a nerd. And we worked together to boil this down into a very, very simple message. Again, vaccination and human diagnostics are critically important. But given that the primary route of transmission for COVID-19 is airborne, mitigation strategies must be complemented with environmental control solutions to reduce the risk of transmission. Note that we're not saying elimination, but there are things that we can do as a holistic approach to be more comprehensive and reduce that risk. So if we take these components individually, and this is actually one of the knowledge products we've created, and you can actually access through the Commit to Care program, it focuses on 4 key things, and we call them the 4 Ds. The risk factors are about duration and density. Density is about the people that you may be coming in contact with in an enclosed room, right? Because you don't know if someone's not wearing a mask if they're vaccinated. You don't know if they're infected or spewing viral particles into the air. So you must be aware about that density of people and that potential pigpen effect of viral particles that may exist. Duration is also a key issue, especially I'm an occupational safety and health professional. So when you're talking about a chemical agent, how long is that person exposed increases their risk of having some significant health impact. Through a viral disease, it is the same thing. The longer you're in that space, the more of those viral-laden particles you inhale, the greater your risk of becoming infected. So risk factors. Now let's talk about risk mitigation factors. That's about dilution and distance. With distance, we'll attack first. It's about communicating to people. The farther you move away from that circle of people, that grouping of people, the lower your risk. However, we want people to also understand that it's been well documented in the scientific literature that being 20 feet away, you still could become infected. Even though your risk has gone down, it still could happen. So there is a balance there. Dilution is the simple one. It's about being outdoors where you're getting UV sunlight will kill the organism. We know from research at DHS that the organism can only survive for 2 to 4 minutes outside. But also the wind, how quickly it will dilute the air around you. But when you move to the indoor space, it's about fresh air coming in. It's about filtering the air. There are things that we can do to dilute the concentration that we might encounter. So as I said again, I double dipped on that slide. My apologies. So there, if you go to the Commit to Care website, there are sequential lessons to help an organization. We actually have a module on determine the relative risk. It's an interactive web-based risk assessment tool. It's very simple, but it helps people to understand, am I in a high-risk grouping or am I in a low-risk grouping? And if you're in high risk, then maybe I should wear an N95. If I'm a lower risk, then the mask may be appropriate for me. All of these different aspects are populated with short 2 to 3 minute videos that are very simple to view and understand about what's happening there. We also have the implementation of workforce training. We advise on face coverings versus personal protective equipment such as respirators. We have a session on improving building ventilation. We have one on determining if, when, and why they need an occupational environmental health safety professional. I am a certified industrial hygienist, And industrial hygienists are trained in risk assessment. We understand how to identify a hazardous agent, whether it be biological, chemical, or physical. We understand the next step is to evaluate that hazard. And once we've evaluated and determined there's a risk, we understand how to control that. There are engineering controls we can put into play to reduce that risk. This applies to the pandemic as well. So understanding why you may need one and how to find an occupational environmental health and safety professional. But we have not ignored the need for developing a vaccination policy or developing a testing policy as well. We also encourage organizations to become partners. And if you go to the website, you'll see that we have some fairly significant partners that are already signed on, such as the National Safety Council, and we have a couple of medical organizations that are there as well. But consider lending your support in one of several ways. If you endorse, you provide your organization's logo to add to the Commit to Care website. You can endorse and share. That means that you're actually going to take the materials and share it with your organization and your membership. And if you want to endorse, share, and lead, that means we want you to really get out there amongst your community, your industry community, and really promote the program. Again, it's free to register. There is no cost to this, and it is trying to level the playing field, if you will, and provide people with an understanding and awareness of environmental strategies to reduce the risk. Our hope is that if an employee comes into a business, they can see a digital badge posted on the wall saying, my employer understands. Or a customer comes in and says, I've been through this. And we're on the same page as far as understanding what needs to be done. So we have different pathways that includes employers, employees, and general public or the media. And we want you to pledge to do your part to making your building, your organization, your community healthy and safer from COVID-19. And if you complete the training, we provide digital badges and also printable materials that you can actually post onto your work site. You can post onto your windows, and there are different categories. You're an allied or partner organization, you're an employer, or you're an employee or general public. So I think I met my time constraints, Katie.
Oh, good. Yeah, time check. So thank you so much for that information. I'll turn it over to the network to see if anyone has any questions.
Yes, I see Wendy's hand.
I just wanted to say, wow, brilliant, Ken. And, working in a school as a teacher, we don't get a lot of things that we have to pay for. So all of this being provided free, I love the idea of actually being able to go in there and assess your risk. So really, really super. Thank you very much. Really good. And great presentation too.
So again, for emphasis, one of the things I want to mention is that we are like-minded in this. And I've been to a couple of the World Health Network meetings, and your priority is aerosol transmission. Your priority is the built space. Your priority is about masking. And we are in the same line of thought there. But it's not being promoted enough. As you're seeing now, only recently in this country, they're going to distribute N95 respirators. But before that, it was making diagnostic testing free. We all know that Omicron can break through. If you're fully vaccinated, meaning 2 shots, the efficacy of the vaccine goes down to 30%. Even if you're boosted, efficacy is still 70%. Remember, for the wild strain for which this was developed for, efficacy for many of the vaccines was up above 90. So that is still a point of consideration.
But Ken, you should just move to Sweden, because in Sweden, COVID isn't airborne. No teachers or pupils need a mask, and we're all doing just fine, or not. That's still the story going on here. So communities like yours are super important for us.
Thank you.
Thank you.
This is so important. I just had an experience where we declined to attend an industry event. It was at a hotel, and we called engineering to ask about the ventilation, and the director of engineering was unable to answer simple questions, nor was the GM. And the event organizers seemed a little surprised at my question. So yeah, I think the challenge here is to make this recognition part of the culture, to make it normative that this is something that we look at, just like masks and vaccination and testing, that this needs to be on the table. It has to be part of the narrative.
Well, and this doesn't only impact the pandemic. I mean, think about the reduction we can do in influenza transmission or cold transmission or other pathogens that may be out there. This will not be the last pandemic. You all know this. I mean, in my time with CDC, I was a part of the response for SARS, for H1N1. I left CDC before Ebola hit, but it's become ever so more of an issue on our radar as we move forward. And we are a global society. People are moving in and out. One thing that always surprised me was when I was a responder to Toronto. Toronto had a huge outbreak of SARS back in 2004. And that's because they had a lot of movement back and forth from where SARS originated, which was in the Asian countries, I think China and a few of the others. Surprisingly enough, the US did not experience any SARS cases, which kind of was mind-boggling to me. But that wasn't the case with H1N1. It burned like wildfire throughout the US. And now with COVID, the same thing is happening.
I think part of the struggle too is Jose Luis Jimenez repeatedly says that when you admit that it's airborne, it moves the responsibility beyond just the individual, and now businesses and governments have to step up and take responsibility. And I think that's part of the challenge, is to overcome that.
Well, that's I think one of the drivers for our Commit to Care is if we can educate people on the simple issues, then maybe an employer will have that informed conversation with their employer. The employee will have an informed conversation with the employer. Or the employer may take the initiative saying, look, these are the things I'm doing for you. I'm not just mandating that you wear masks in here, but look at what I've done in the ventilation system. I had 2 portable air cleaners in here. So we're reducing the risk because we're diluting what might be in the air.
Exactly.
We have time for a couple more comments or questions.
In regards specifically to the K-12 environment, do you have any advice for parent advocates in regards to trying to get schools more involved with that side of things, with improved ventilation, the importance of masking right now? As you probably know, there's a lot of pushback in regards to having masks in schools. In Michigan, we have a couple of industrial hygienists that are quite influential and influencing school boards to not require masks, saying that they don't work.
Yeah, I know.
On the HVAC side of things,
I know of one of those individuals without naming them, and their logic is flawed. I mean, the broader industrial hygiene community, and which is why we're so strongly partnered with the American Industrial Hygiene Association, does not believe that masks do work. They don't work as effectively as an N95. That much is accepted. But if we're focusing on not eliminating risk but reducing the risk, even if my risk is reduced by 25%, that's something positive. So for schools, it's about we do have a session on schools. We actually have a speaker from the National Education Association, a speaker from healthyschools.org, and a speaker from, she's a principal of a high school in Georgia who won the award last year for Principal of the Year. So, and we're looking to pull in one more speaker, hopefully from the American Federation of Teachers. But I'm learning very quickly that it's about knowing the questions to ask. Because schools will go to an HVAC system and they don't really understand it. Oh, I've got this UV light system I can put in there. Or I've got this ozone generator, things that have not been proven. I do know that UV works, but I question whether it works in a ventilation system because like any other radiation, UV is about contact time and distance from the light source. And I don't think you can get that in a ventilation system unless you have a super, super high intensity. So it's trying to direct those who make the decisions to the right knowledge so that they can make appropriate decisions. They don't need, some systems cannot handle upgrades to a HEPA filtered system or even a MERV 13 because they're older, they're dated, and it'll burn out the HVAC system, quite frankly. But how difficult is it to put in a recirculating HEPA system, which are commonly available from your local warehouse or your Home Depot or Lowe's. I just helped out a gentleman at a church and advised them to purchase up something that would fit their room space. And it's a HEPA filter. It's a well-known product, and it will do just as well as installing higher efficiency filters in their HVAC system. Yes, Wendy.
I've been trying to let people know a little bit on Omicron and the difference between the different types of masks. So I was thinking like a cloth mask is probably max 10% now against Omicron. Surgical masks, I've heard 20 to 30% possibly. Then we've got what you call the N95 that we call the FFP2. Are we talking like 90% for them? And 99%, is that still valid for the KN95s that we call FFP3? I mean, is this correct ballpark, or am I in the wrong area here?
I don't think the research is really that I've seen as far as the masks. I've seen differing numbers. There is some epidemiologic studies have been conducted in healthcare settings that for influenza that have shown for respiratory diseases that the wearing of masks does in fact reduce the risk of transmission for influenza and a few other diseases. So there is an abundance of scientific information that masks do work. They reduce the risk. No, they're not as effective as an N95. But understand, too, that N95 is not just about the filtering ability. It's about educating the wearer about what's a good face seal. Am I wearing it properly? And KN95s do not have head straps. They use ear loops, which do not secure as effectively. Now, as far as addressing the KN95, the last session of the summit that we held in 2020 addressed the issue of counterfeit and fraud. There are a lot of fake KN95s that's coming from China. There are some quality KN95s that are coming from China, but NIOSH has actually evaluated many of these and has shown some of these are getting only a filter efficiency of less than 5%. Some are making the grade and getting above 90%, but are they getting the quality of fit? Understand that an N95 has what we call an assigned protection factor of 10, meaning that outside the mask, it will reduce the concentration of any particle to 10% inside. No one is asking the question, is that okay? Is that enough? Because we do not know what the infectious dose of COVID-19 is. And without that knowledge, we can't really make a definitive statement of whether it's protective enough or not. So again, it's not a message about eliminating the risk. It's a message about reducing the risk. And we reduce the risk through complementary strategies: ventilation, mask wearing, social distancing, working outside more when we can. All of these things will help to reduce that risk.
Thank you, Ken. We are at the half-hour mark.
Okay.
I welcome folks to stay on. And Ken, if you have time, you're welcome to stay on and chat. But we will wrap up the formal part of this conversation now. So thank you so much for your time, and thank you everyone today for joining us.
Well, once again, please, if you can, join us for the Clean Summit next week. Again, there's no charge for it. All right, it's long, but you can join for whatever you want. And think about going to our weareibec.org and joining us, or at least signing up for the Commit to Care Pledge. And unfortunately, Katie, I have to log off. I've got another presentation this evening with One Health in DC. Dr. Moreau and I are presenting on IBEC and Commit to Care.
Well, I'm glad you had your warm-up here tonight.
Right. Thank you all. Take care.
Thank you.
Thank you for the great work you're doing.
Thank you.
Thanks, Ken. Take care.
Thank you.